Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. I am Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and today my guest is Dr. Aida Suhaimi. Dr. Aida is a clinical psychologist in Dubai. She got her bachelor's and master's in psychology in Australia and a PhD in Malaysia, with more than 14 years of experience in clinical psychology across Australia, Malaysia, and the United Arab Emirates. Dr. Aida Suhaimi has a special interest in women's mental health and in child and adult psychological assessments. Welcome, Dr. Aida, to Medcast.
Hi, Dr. Wafaa. Thanks for
Hi.
having me.
Thank you for being with us. We are privileged to have you today.
Of course.
And today with you, we are going to discuss a very important topic, which is how to have a healthy parent-child relationship. And we're going to give tips about excellent parenting. And I think this is very important topic to every parent or parent-to-be.
Yes, very important for sure, Dr. Wafaa.
For sure. So, but before we start our discussion about parenting and healthy parenting, I want to ask you why mental health now is everywhere. Why the awareness about mental health just came in these few years. Why it was not before or in the past few years. Why we're not having this awareness about mental health, let's say when we were studying medicine, for example, 10 years ago.
Yeah, it is true. And it's not that, people say, is it because there's been a rise in mental health issues? But in reality, it has always been there. But because there's a lack of awareness, people didn't know what it was. People just thought, oh, you're just being a bit weird. You'll get out of it. You'll snap out of it. And people do struggle even before. But I truly believe that I think during COVID, despite it's so unfortunate that there is actually, a bright side of it is that there was a much more discussion about mental health. So I think since then, a lot of mental health awareness in social media, in news, it's all out there. And because there's a lot more awareness, there's less stigma, right? And that's where people are reaching out for help.
Yes, definitely. And I think social media, you mentioned it helped.
Oh, yes.
Because it can reach everyone,
Yes,
right?
and hopefully this
Yes.
podcast as well.
That's
for
why
sure.
we are here. And
Yes.
we want to also reach for awareness about parenting to the majority of the parents and to the biggest crowd we can, let's say.
Yes.
So when it comes to parenting, there are different stages of a child's life, as we know. So from infancy to toddlerhood, to early childhood, to pre-adolescent years, and then to finally teenagers or the adolescent years.
Yeah.
So today in this podcast, we'll give some awareness about parenting during all these stages in the child's life. And we'll focus, of course, about the most important topics or the most common challenges probably that parents can face, because it is a broad topic, as we mentioned. Starting with parenting in general, and to build a healthy parent-child relationship is something not easy, because as parents, we are not given a job description. No one taught us, unfortunately, at school what to do when we are parents and how to raise these kids to be emotionally stable and resilient children. And all what we have are just observations or some experiences we had as children ourselves.
Yes.
So starting with infancy.
Yep.
Starting with infancy, what are the major developmental or psychosocial developmental milestones that parents have to be aware about, and how can they foster secure connection between themselves and their infant?
So you would say around infancy is around 0 to 18 months, right? And 0 to 18 months is where you want to start to build a secure attachment. So if you were to say there's this psychosocial stage development theory by Erickson that said during the 0 to 18 months is when there is a conflict between trust and mistrust. So you can imagine the kids, the babies, they are really trying to explore the world. So during this stage, feeding is also a very important part. So when they cry, they expect that the parents or whoever the caregivers are will come to them, right? So they are trying to build trust. This is the people that I can trust. These are the environment that can actually make me feel secure because I am really exploring what's around me. So usually during 0 to 18 months, I would really emphasize on touch, on going into the 5 senses, touching them, smelling them, holding them, hugging them, and a lot of conversation. And when I say conversation, obviously not in 18 months, but the peekaboo, lullabies, sing to them. So these are really, really stimulating for from 0 to 18 months. So they start to learn the voices, the sound around them, the touch of the people who care and love them. So during this time, it's all about building trust and secure attachment.
Wow, there's so much there, really.
Yeah.
I love that. So they are born with the feelings, right? They are born with the feelings,
Yeah.
and they just want to discover
Yes.
how they can deal with the surrounding,
Yes.
or the skills to deal with the surrounding
Right.
when they have these feelings.
Yeah.
Yes, brilliant.
Yeah, and I remembered some of my patients come in and they will be saying, when the child farts, for example, like a 3 weeks year three farts, and then they it's a sound and it just makes the whole house laugh, and that's the kind of environment that you want to provide for the child.
Yes. Going to toddlerhood. So the toddler, of course, he is able to discover more. He has some sort of independence, and he wants to see how this independence that he has can work with the people around him. So they start to have sometimes tantrums. The toddlers are very known for their tantrums. So you sometimes ask a parent, how do you deal with, for example, a child who is not listening, a toddler who is not listening? Let's say we're speaking about toddlers. He's jumping all around and doing some mess in an inappropriate situation.
Yeah.
And the parents, even it's not related to their degree of education. They can be very educated parents and very successful. And they tell you, I have no idea how to stop this behavior, or what to say to this toddler, and how to make him do the proper thing.
Yeah.
So, what's your advice when it comes to toddler tantrums? How can parents really manage these behaviors? Let's say.
Dr. Wafaa, I must say it's difficult, right? And I usually say, yes, it takes a lot of patience, and for sure it's not easy. So what I usually say, so let's say a toddler between 2 to 3 years old, what we'll see is they'll start to become very autonomous, like they want to do everything independently. And when they don't do that, sometimes that is where the tantrums comes in. So around this stage is where they want to be independent, but then there's also this conflict between shame and guilt, or shame and doubt. Because if they want to explore, and then they explore, they try, they spill things, they start writing on walls, all of that. And then they are being, they receive this critical or shouting or screaming that will actually develop in a way a sense of guilt and shame. Right? So it's actually a lot of balance there. So in this child, we need to support their independence. We need to let them explore, obviously within boundaries, within safety, right? And if they go through from that boundary, that is where you come in and you put out the rules, right? Because those are very, very important to put out rules and boundaries, even at that age. And I'm not saying like really strict. If you know that the child likes to draw, then you find alternatives where it is not going to be too harmful for the walls in your house, right? So we are trying to find kind, safe alternatives, but they are still able to explore. And during the age of around 3 to 5 years old is where they start to be a bit more curious and they want to play. Play. So this is where the parents needs to really play with their child, right? So this age, so at first it was just exploration. 3 to 5, it's all about play. So they just want to just do things and they want the parents' attention. right? And I know a lot of parents do struggle with this, trying to balance life, work. So this is where, allocate time. It could be busy time from work, come back and tell yourself as parents, I'm going to spend 1 hour and I'm just going to play, be present and play with my child. Trust me, that half an hour or that 1 hour that you take to be present will mean so much to that child. Even though they know that you're not there the whole day because of work, but when you do spend that quality playtime, that's the most important thing. That is what you would want to look for during that 3 to 5 years old. So this tantrums comes in because all those demands are not being met.
Very
Right?
true.
Yeah. So this is where, again, when you are faced with tantrums, parents, be present, be calm. It always starts there, because if you also elevate your anger, your mood, then it also means their tantrums will go further or go longer. But if you're, as parents, you keep yourself calm, then are you able to actually manage those tantrums better?
Very nice. Really, I love that. So you mentioned many important words, let's say here. You mentioned rules and boundaries. And you know how important these are, these two words in the raising children in general, in parenting. However, as we said, that many parents, I see sometimes in my clinic, in my own clinic, in pediatric clinic, that many parents are struggling to set rules and to set boundaries for their children because they feel more that they are like they are not being empathic enough, and they have like they don't want to hurt the child's feeling, and you, as you mentioned, the children crave rules. Children need boundaries as much as they need attention, and they need to be like listened to, and they need the quality time, which will, I think, solve all the problem. But without any judgment, this new world that we are living, the busy parents and long times at work, of course they are not easy on the parents themselves. However, with will and determination, I think they can still have this 1 hour or at least half an hour of quality time to play with their kids or to listen to them, depending on the stage. Yes.
And one thing if I may add, the most important thing, and it's also most difficult for a lot of parents or parenting, even myself, I must say, is consistency. Right? You've got to be consistent. If you want to put rules and boundaries, you got to be consistent. You can't say it's because I say so today, and tomorrow, because you're a bit more relaxed, they get away with it.
Exactly.
You get what I mean? So if you set rules and boundaries, make sure that you're also consistent throughout as well.
How to make sure that when we are setting the rules and the boundaries, we are not like, as we said, we are not affecting the empathy and the connection that we have with the child. How we can mix them together and get the best result. Like if you can give us even an example in real life situation. For example, a child who is from 3 to 4, let's say, or 3 to 5 years old, refusing to go to bed, let's say on time or early. How can a parent set the boundary and make the child sleep on this right time? And how can he keep, like they can keep this relationship, like this loving relationship or this empathy going on?
Yeah. So obviously, like there's different stages. So let's say between 3 to 5, again, they need a lot of assurance as well. So I won't say rules and boundaries are opposites from empathy. They are actually two different things. They're not even in the spectrum, right? Like it's not even one end. If you're having rules and boundaries, therefore you cannot put empathy. It is actually just a different component, and it can definitely go together. So if you want to put rules and boundaries, just as simple as sleeping time is at around 8 p.m. or, okay, let's say 8 p.m. And then there's always that, and this is where the parents come in, where you start to set, activities or things, before the bedtime. So there already preparation happening, right? So it's not like it just, okay, suddenly watching TV, 8 p.m., go to bed, right? So this is where you're creating that empathy. You're also, preparing them that this is already a routine that that it is, and then they start to go, I don't want, and then they start to say, no, I want to do this, I want to go there. So this is where the parents and both parents need to be at par, at the same, you got to be in the same feel where both are saying, no, it's time to go to bed. It cannot be, Mom, you got to go to bed. Dad still watches TV. No, you can still have another half an hour. This is where it becomes a problem. Both parents need to have the same rules and also use the same way of parenting as well.
Yes. So if the child starts screaming then, you told him it's time to bed, you prepared, you did the correct like job for you as a parent to do, and the child starts screaming. Is it okay? Do we leave him to scream, to feel these feelings that, he has to stick to some rules, he has to manage his behaviors or whatever? So
this is very a tricky question, and obviously every child is very different, right? So usually they would cry, they would have a tantrum. So this is where a lot of touch, hugging, reassure, it's time to go to bed, be strict, be consistent, right? And I'm always going to be here. I still love you, but you know the rule of the house, 8 p.m., go to sleep. And they'll be like, that. So both parents needs to be there and assure them, I still love you and we still care for you. And tomorrow morning, we're going to be doing this and this and this, right? But right now, it's time for you to go to sleep. So kind of like go back, always like a broken record. Continuing again and again. I know it's tiring, parents. It's not easy, but I must say, the more you're consistent you are, that you'll see the fruit of your efforts.
That's going to be a successful result. So brilliant. So for now, we finished the toddlerhood, the early childhood or preschoolers. We come to the school years, the school-aged children. So during these school years, of course, children are going to schools and they are starting to learn how to, what practices can parents do in order to foster the love of learning, first of all?
Yeah, that's obviously when they start to go to school, they start to learn the outside world, things that is, outside from the house. So they're going to meet people, they start to learn about themselves and they start to want to be better. So if they start to learn something, I want to be good in whatever I'm doing. I want to be good if I were to do any sports. So these are kind of things where they really look forward to, right? And this is where to provide that support for learning is where you encourage them, even though if they make mistakes, you don't say if they make a mistake, you say a good job. Don't do that because you're praising at the wrong place. So it's like, okay, that was a bit difficult, that was a bit tricky. We'll try something else, or you know what, we can practice this, and I'll be with you, and we'll do this together. All right. So it's also to allow failures, right? Because sometimes we as parents, we feel very protective. Like, I don't want them to, it could be a sports game and they lose. And it's like, I don't want them to feel that loss. And we get upset as parents. But you know what? That's also part of life, isn't it? Right? So they need to learn those difficult times, but also know that they are being supported. And they know who they can go to talk about those difficult emotions as well. Right. So you as parents, you got to be ready to also listen to those difficult things as well. Yeah.
So something not easy is to ask the child after school, for example, how was your day? So he will say good, or what, he doesn't know what to tell us. So is there a way like we can make them express their feelings and tell us, the exciting things, the good things that happened, and maybe the not really the best things that happened to them from bullying or any challenge that they faced during their day, in order to be able to help them and to support them or to explain to them, but how to get them to the to them expressing their feelings. Is there a special tip or tool we can get from you?
Okay, I'll try. So what I've also seen with a lot, I learn a lot from my patients as well, because they're, parents, it's always, to me, it's a trial and error, right? You can never get it.
Yeah, we don't have rules or certain...
exactly. Like a book, like a booklet 101.
For relationships in general, it's not something easy. We're still, easy. I think, learning very in kindergarten, let's say, when it comes to relationships. Human relationships in general.
I agree. So one of the things is, I would always say, is to always have that open dialogue with your child, right? Usually children will, if they see you as a very, secure parent, right? They have a secure attachment, they would definitely come to you. But I want you to try and imagine if someone, if a child comes to you and like, okay, why don't you do this? Or why did you do that? it's straight away with criticism or, putting the spotlight on them, I don't think they will come back to you. All right, to be fair, right? So that is when the child starts to like not wanting to say anything, because they start to say, if I say this, then mom will think I'm this, or if I say this, then mom will tell me to do this. So always go in with curiosity, right? And that's how sometimes the question is like, oh, how was your day? Sometimes it's too, I guess, scripted as well. So they'll say, yep, it's fine, right? So maybe change up some of the questions as well. It could be, oh, did you do anything exciting today? Did you do anything that was kind towards others today? Was there anything that made you excited or upset? So you use your own emotional words, right? So they can express themselves. And, and it's also, to me, as parents, we got to also be in their level as well. So they could say, oh, you know what, today I had a bad day, because the washing machine wasn't working. So kind of like not go into details, your work problem, but just into details, so that when they see you are also being able to open up to difficult emotions, they too will be able to come to you to talk about it as well.
Okay. So a very important topic in this school-age children, the screen times.
Ooh.
So how can parents limit screen times in the early childhood years?
Okay. Again, rules and boundaries, isn't it? Right? If you start to have good rules and boundaries early on, it's easier for it to continue on as they grow older. But if you've already allowed them, at 3 and 5 years old, the endless screen time, then it's going to be hard to actually put those boundaries suddenly when they start to go to school. So that's the first thing. So you kind of establish rules and boundaries at much early on. So when we put the rules, and I can tell you this is a huge struggle with many, many parents, right? And many, many families as well. Because if the boundaries was not set early on, then if you're putting a limit suddenly, which is also hard, but not impossible, there needs to be consistency again, right? Because it has to go both ways. As both parents, everyone in the house has the same rule. It cannot be different. So if you're saying, no, your boundaries, your rule is 2 hours after, every day, or it could be even 2 hours during weekends, right? So when we say you only have 2 hours, but you also have to think, what are you going to use are they going to use the other hours in the day for?
I need to keep them busy and good.
Yeah, so you cannot say you don't do this, but you don't give them an alternative.
Exactly.
So they're going to struggle, right? So just to be fair for the
Yes.
child, if you say you have only 2 hours, and then we're going to go swimming, or we're going to 2 hours, then you can go out and play basketball with your friends, whatever. So you kind of give an alternative, so that they too don't feel like, 2 hours, and then what am I going to do? Do you have anything else to do? So, and then they see their parents on the phone. So that is also another issue.
It's a challenge nowadays, really.
Yes.
But we are managing, as you said, with alternatives. Always offer the alternatives, and it works. For me so far, whenever there's an activity outdoors or with friends, it's always preferred for them.
Yes, true.
Yes. Coming to the pre-teens or the pre-adolescent years, of course, there are a lot of changes here. And how to help the child or to boost the self-esteem in these children. How to, make them overcome the problems from peer pressure to bullying. What's our role as parents? A few tips from your side,
Yeah. So if we're talking about with preteens, I always say monkey see, monkey do, right? So be a good role model, right? If they see a good role model in their life, right, they will also persevere towards that, aspire towards that as well. So this is one way to actually have good self-esteem. Sometimes you don't have to say much, but when you do things that actually shows positivity, that will also help them as well. Open conversations, open dialogue is very, very important. And one of the things is also try and look into the interests of the child. What is the child interested in, or the teen is interested in? And you try and boost that and try and work that towards what they like.
Yes. And to encourage social relationships with their friends, with their environment also can be encouraged. This can help.
Agree. I must say this. So, for example, during let's say teens, we'll say around 12 years and above. Everything then it's all about friends.
Yes,
Everything.
we're coming there. They're
Yeah.
coming. Adolescent years.
Yeah, and when
Yes.
it's all about friends, and if you see your child not wanting to go out, not wanting to talk to anyone, do not have any group of friends, that could also be some signs of an issue or a mental health issue, right? So, in my opinion, quickly seek help, right? If they are really struggling, there could be something else going on there, right? Because in terms of normal development, it's not normal for any child to not want to be with their friends around that age.
Exactly. So I will come to this big topic, also adolescence. And I think some people refer to this age group as like a big problem. In my opinion, this is a big opportunity because these are the future. These are we are preparing them to adulthood, to be the leaders, to be the parents, to be the people who will let's say replace us, for example. So this is a very critical time, and this is I'm very passionate to speak about adolescents in general because I have a feeling that their needs are not met in many different aspects in all over the world in different cultures. So because we for example in medicine, and let's say as pediatrician, we refer to this age group as healthy. Parents think they are healthy because they are eating, drinking, you don't have to force them to eat. They are playing. They have started to have a big build, and they're getting taller. So they think they are healthy while they are missing on many of their even medical checkups. And there is also some of their immunizations. They are not taking it. The parents think that they are growing, so there no need for immunization. They are missing on adolescent immunizations, and unfortunately nowadays they are the most age group at risk for diseases because they tend to gather, and for example they watch football games, they like gatherings, they go to
and a bit
dormitories,
risky as well.
and they try to do risky things to discover and the world, and they are always with friends, as you mentioned. Everything is friendship to them. So really we don't want to miss on this very important age group in the society. However, from the psychological point of view or psychosocial point of view, how do parents, because we are speaking about parenting and a good parent-adolescent relationship now, how do the parents can keep a good communication between themselves and the adolescent? How to keep this good relationship, for example, that they have started, because everything has a foundation. They, of course, they should have been starting a healthy relationship with this adolescent when he was a child. How to continue in this healthy communication, and how to have this as you said, open communication, allowing them to express whatever they are feeling. They're also the body changes that they have, the identity.
So I would usually, I would say to parents, always, when you do have a conversation, go in with a lot of curiosity, right? So if you want to have those conversations, want them to even talk to you, you go in a way with no judgment, right? Oh, you must be doing this because of this. Oh, is it because of this friend who's telling you to do this? So they won't tell you anything, right? And that's where you don't want, unfortunately, they will be experiencing a lot of things out there. There are going to be a lot of things that are going to be, affected to influence them. But you want to have that attachment, a secure attachment for them to come back and to be able to tell you and make those right judgments. So to allow that as well, to have that conversation, do not have too much judgment there, open with curiosity, allow them to actually talk to you, right? And also, if they make mistakes, right? Obviously, rules and boundaries are very important, but also give them time to also understand where they are coming from.
True. So we are parents, and we also, as we said, we are trying. So we can have mistakes also in dealing with the adolescent, and the adolescents or the adolescent now is rejecting us as a parent. So, for example, you're trying to talk to your daughter, who's a teenager, and she tells you, no, I don't want to talk, and she goes to her room and locks the door and locks herself in, and she doesn't want you to talk to her. Probably she will avoid you for a couple of days sometimes. So what's your message to the parent? What does the mom, for example, or the father has to give up? Or do they need to keep trying? Or do they need maybe to give more love? Because this is maybe a sign that something wrong is going.
Yeah.
What do they do in the situation of rejection? Because I hear it a lot, and those who are raising adolescents, they face it a lot.
Yes. Parents, it's hard.
Yes.
And I feel you. So I would say during this time, never give up. In any circumstances, don't ever give up, parents, right? Don't ever do that. What I would say is if it becomes difficult for the family, you're not going to be able to get in touch, I think that this is already a time to actually reach out. For me, be a mental health professional or a professional to help them through that. Because if you've tried, it's not that you've not tried. You've tried to connect with them, but they're not letting you, then maybe there could be something else that's going on, but they're not willing to open up yet, right? So sometimes we need kind of like a third party or a professional to help them go through it and help them through the whole family through that as well.
Right. So this takes me to the second question.
Yeah.
So when they are rejecting us, we know there is something wrong, and all what we do, as you said, we don't give up, and we try to give more love, more understanding, more let's say calmness. But we could not do it on our own for a certain reason. We seek you for what are the red flags or what are the signs that that if parents see their adolescent is going through, has to seek a professional mental health support.
So that's a very good question, Dr. Wafaa, because what we usually say is when there's a deterioration or a change in functioning or behavior, right? So maybe they used to go out, they don't want to go out anymore. Maybe they used to talk to you, they don't want to talk to you anymore. Maybe they used to, eat healthily, now they start to pick and choose what they eat. So if you see there's a change in behavior, change in functioning, that's usually a signal, right? Especially sleeping for this age group as well. All right. So if you talk to them, you try and talk to them calmly, kindly, caring. But if it's not working, maybe it's also time to also reach out for that help.
Right. And the help can be offered, and it's usually successful, right?
Yes.
Like you are seeing adolescents at your clinic. How's the situation going in your practice?
And I guess, one thing I want to advocate, because a lot of the times by the time they come to us, the functioning has deteriorated quite a lot, right?
So a lot of work is needed.
Yeah, and I think a lot more effort needs to be put in, and it has been going on for a long time. So you can imagine to actually bounce back takes longer as well. So if you could come in earlier, right, then we can actually work, the early intervention is the best, right? So that is where I would usually say, come in when you see a change in behavior, and even sometimes it could be nothing, but it's good to get that reassurance as well. What you're doing is also in line with what you need to do.
Yes. Early is always preferred,
Yes.
Interfering early, even in medical and mental health and everything, and physical health is always the best approach. So my last question, how do the parents help, or what's the role in preparing these adolescents for adult life in a healthy way? Is it probably taking them to be exposed to certain, let's say, fields, or open communication all the time, or how do they do this preparation for the transition from adolescence to adult life? Is there any role that the parent has to play?
Yeah. So during this teenagers is where they start to seek role, their own identity.
They need their impact in life.
Yes.
How to help them to have the impact in life? This is what I really wanted to ask.
Because that's a very tough question.
Yes.
But
And
and this is where to give that impact is where you want to build that. It's not a one day. Rome was not built in one day. So, you want to build something that's, a healthy person. It takes, time. But as you explore what's their interest, you allow, them to explore what they like. And then once they start to see, a certain interest, then you start to channel it and you start to groom it and support them in those areas, right? So when they know that they're going to try it out and there's going to be a possibility that I'm going to fail, but I know that I get the support and I know that there's something that I can learn from this. So this is where you want to also have those discussions with them. So in terms of going to adulthood, please, you need to provide responsibility, right? And I think there's been, there needs to be more and more responsibility given to this age group, because they are going to be more independent later. Parents, you're not always going to be there for them, right? So the more they become more responsible, the more they're going to understand what's right and wrong, what needs to be done, right? And that could also really build an impact on their life wherever they go.
Wow, I love this discussion so much. I wish we have more time to continue discussing parenting, because it's really interesting, and I think many people need to listen what you are for what you are telling us. And I want to give now the final word to you, Dr. Aida Suhaimi. What's your message to the parents or the parents to be who are listening to this podcast? What's your message to them in this like modern world, let's say, we are living in?
I must say, now and never, like right now, parenting is even more difficult, right? There's so much stimulation out there and from everywhere. So it's not easy, parents, and I agree that it is going to be a journey, but it's going to be worthwhile. So patience, consistency, and also be curious, right? Open to curiosity and learn and understand your child better.
Dr. Aida Suhaimi, thank you very much for being with us today.
Thank you. Thank you for having me. It's been such a pleasure.
Thank you.